Hi, Assalamu alaikum. Today's video is about how to prep for an elective rotation if you're coming in as an IMG, and some things, there are advice that you might want to remember or might help you. So let's just get right into it. Number one is to acknowledge and be very respectful of all your staff members. So remember that US healthcare system is unique because you have roles like PA and NPs and DOs and all your ancillary staff, like a respiratory therapist is in there, and your MAs and nurses, and it's a very collaborative care if you're in a hospital, especially in a tertiary care system, or even as an outpatient. Honestly, even in an outpatient, you'll see that there are a lot more roles that are assigned. And the important thing to remember is that while you may not be familiar with the roles, you can't really tell who's a doctor, who's not a doctor, and what these terms mean. And there's definitely a lot of cool posts about it on Reddit and student doc networks and stuff like that that you can read about to educate yourself. But you definitely want to be educated and aware of these roles that exist when you come here, and greet everybody, be very respectful, understand that it's a collaborative care system, and that everybody has a very vital role to play in your patient care. And going with that kind of an attitude where you're trying to impress the attending as much as you're trying to impress like the MA is going to go a long way, because it's not about being humble or trying to come up with a strategic way to like get in someone's books so like you can get something. It's really just about being a professional that recognizes that the patient comes first and everybody gets to do that for them in some capacity, and everybody's vital to their care. So doing that is very important, and it's going to develop your collaborative skills, which are going to be required as a resident, going to be required as a attending. It's always going to be required if you're in the US healthcare system. You're never going to not want to develop these skills. So that's number one. Number two is to be a really good note taker. So if you want to specifically impress your attending to get a good letter, other than being punctual, being there, the basics, which I might stress, I might not stress, but that's something you should know. Look professional, look nice, smell good, you know what I mean? Be on time, all that stuff. The second thing is to have a really good note-taking skill. So you really want to develop your HOPI with your pertinent positives, pertinent negatives, along with your labs and everything that you need in one really long note. And when I say long, it doesn't mean to be fluffy. You have to have very important things in there, but don't stop at an HOPI and just developing your differentials. You know what I mean? It should be a good page or a half a page for sure if you're an IM resident or you want to be an IM resident. If for other specialties, I don't know how it goes, but I'm pretty sure you should have a good, strong HOPI. So one good thing is to go onto the AMA, ACGME, yeah, probably that. American Medical Student Association or ACGME will list the duties or the kind of roles that are required of a resident, and kind of acquainting yourself with that language and knowing that those are the skills that you should be working on, or that is the kind of evaluation that your attending is probably going to be looking at when they're looking at a student that's coming from a different country, is very important. And it will kind of familiarize or like open your eyes to, oh, well, this is something I have and this is what I don't have. I should be acquainted on. So there's a list of those things on AMA or ACGME website. You might want to look at that. Writing a good note goes a long way. Your attending will be able to trust you and be impressed, like he'll be impressed or she'll be impressed that you can be detail oriented and really understand the complexity of the patients. So yeah, good note taking is very important. I could go into a good note, what makes a good note, but that's just gonna make this video longer, so I don't want to keep it too long. I want to keep it short. Excuse the fact that I'm not wearing my hijab. I wanted to look cute, so I'm going through something. Anyway, so that was my second point. The third point is, if you're going into a hospital instead of an outpatient setting, either you're going into an outpatient setting, what to do for that, or if you're going into an inpatient setting, what to do for that. So if you're going to an inpatient setting, I would say develop a systems-based approach to your patient. So when I was at Houston Methodist Texas Medical Center, that was the most challenging rotation that I've been in. So I'm going to address some tips that I have about that because I think that is most applicable. So at Houston Methodist Texas Medical Center, I was assigned to patients that were very complex, in the sense that, not very complex, but they were complex. They were transplant patients with a bunch of comorbidities that had been seen in multiple facilities. And even though I only saw probably 3, 4, 5 patients maximum in a night, it was an overnight rotation. Our team probably saw 15, right? And you couldn't just kind of ignore what the other people were doing. So you needed to have a systems-based approach and kind of acclimate to that academically challenging environment within the first week. I was kind of clueless, to be honest, when I went in there, because the rotations that I had done previously were not like this at all. This was a lot more, I had navigated Epic before, so working as a medical assistant, I was aware that, you need to review the charts and stuff, but a lot of these patients had, 30, 40 visits. There was no like clean slate that was coming in. Maybe like one patient came in like that, but we didn't get assigned any of those patients. You know what I mean? Even a DKA patient had like a bunch of other things going on, which is a typical internal medicine like patient. You know what I mean? If you're an IM, that's very typical. I don't know why, but I hadn't experienced that before. So my point is that when you're in that kind of an environment, the first thing that you want to develop is that, all right, what is my strategy? And here's what my strategy was. It might help you. I would review the charts of the patient, and instead of just writing down what I need to remember or like, oh, this is important, I would really at that time start my note, because the ER probably made something, the ER person that received them, they had probably given you maybe like 4 or 5 lines or something, and it's enough to start something. And looking at their labs that had been done previously, I would say their most recent visit showed da-da-da-da-da-da. Even if I'm gonna put that in my note or not gonna put that in my note, I wanted it to be in there anyway, because once I went into the patient room, I wanted just the important stuff that I've seen in their past echo, past whatever, EKG, last EKG showed this. If we've done an EKG now, then obviously I'm not going to put the EKG that was done 2 weeks ago, because we might not care, or the doctor is just going to look at it if he wants to. But I just think putting in findings as well as pertinent positive, pertinent negatives, your whole HUPI, which is your symptoms based, like what the patient is telling you, and then also putting in lab findings and echo findings that are important to the presentation is very important, so that when you're attending or someone in a ward reads the note, they kind of have the most important things there. And if you can do that as a resident, that is going to make you stand out really well, and also be less challenging for you, because I think the hardest part for me at that point was kind of going back and forth and trying to understand, how do I read everything that I need to read about this patient before I go into the room and remember it, and then come back and then put my stuff together and then their stuff together, and then also get the labs in and make a note. And that whole process would take you an hour. You know what I mean? You don't want to take an hour. You want to have your systems-based approach. And when I say systems-based approach, I mean, okay, so let's just say this patient is a cardio patient, or an endo patient, or whatever. How am I bringing in, and what am I looking for? Certain comorbidities like diabetes and CKD and dialysis, transplants, I would review that stuff before you even come in, because it's gonna come up, and your attendings might ask you questions about that too, so you might want to just put all of that in there. Very important. You want to review certain topics, study before you come, but I think everybody will tell you that, or maybe they won't, but I'll mention that you should study the comorbidities, because no matter what happens, if you're in an ER setting or an outpatient setting, the ones that are the chronic diseases, the chronic disease burden is high in the US. You want to know which diseases that is, and then just study that. You don't need to know every single minute thing when you are in the clinical setting. Like, you can't review all of internal medicine coming in 2 weeks before, especially if you were working something on something else. You know what I mean? or if you were in a research setting and now you're coming into a clinical setting. So you might not be able to review all of IM, but having a list of 10 to 15 diseases that you know you're gonna see and review them, it goes a long way. Prep, that stuff. So writing a good note and acclimating to a challenging environment by having an approach and a strategy goes a long way. So the first week that you're there, you just want to develop your strategy, keep your personality to a minimal. You just kind of want to see what your attending likes, what the environment is, what is the volume of the patients, what is the flow like, what would be disruptive, what is non-disruptive, because you are a student and you are an observer. You don't want to slow them down, or you don't want to, you know what I mean? Like, you don't want to be someone that they're having to tolerate. You want to kind of vibe with them and kind of see what the office is like or the staff is like. And so, that's the first thing. And now if you're going into an outpatient setting, I think the most important thing, again, is to know your office. The most important thing is that they don't want, the office has patients scheduled and stuff, and you don't want to slow them down. I think that was the most important thing that I kind of figured out is important to figure out first week or so. Like, you don't want to take an hour taking a history in a chronic care setting, because most patients are coming in and out and they're just there to see their PCP for 15 to 20 minutes. You don't want to, you know what I mean? I know you want to learn, and everybody was kind of excited when they first go in. But my advice is to not take 30-40 minutes taking a history. In fact, focus on formulating treatment plans, learning about guidelines, preventative care, screenings, and asking those questions, along with getting a good history as well. So you do this, and I remember my attending would take 10 minutes with a patient, and especially the ones that were coming in for their tests to be reviewed, their Holter monitor being reviewed or something, and he would be like, all right, you can go talk to the patient. When you kind of get that patient, you don't want to take 20 minutes talking to that patient, because that's going to be a problem for your attending, or you know what I mean? You just want to talk to them enough to get an idea of what's going on, and then focus on what they're there for and learn that thing. And so that if your attending was to ask you a question, then you would know what to do. And so outpatient is different than an inpatient setting. And outpatient, you don't want to slow them down, because it's like probably a heavy load and most offices are busy. And if they have students there and there's research going on there, it's like a whole setting. In primary care, I remember my attending was very polite in Springfield. She said, it's okay. What we're going to do is we're just going to have you do every other patient. By the end of the 4th week, she realized that I was taking my time and I was just very thorough. So she wanted me to be like, all right, we can just do that. So most of these outpatient settings that are affiliated with a university hospital or a hospital would do it in a way that it would be like, I would be at the clinical care setting. So I did 2 of these. I did one at La Sante Healthcare Center and one at a primary care office in Springfield, Virginia. Both of them were affiliated with, when I say affiliated, I mean that the attending was an academic affiliate, or they were working at a hospital. So they would take me in the evenings to the hospital at Holy Cross, or once a week or twice a week I was able to go to SUNY Downstate. And when you're at the hospital, when under them, you're not really, again, when you're in that situation, it's not hands-on. It's not like you can go examine the patient in these wards, even if you're admitting them, even if you're doing that, because it's not like an inpatient rotation. At that point, what they're expecting is that you can review important information in the labs and then round on these patients with your attending, understand what's going on. So understand what's going on and just kind of get information and then put it in. So just kind of see how much is okay, and then don't push for things like, I want to be able to examine the patient, and if I'm able to touch them, then if it's hands-on, then that's what is the most important thing. Because sometimes an observership with somebody who is a university affiliate, or in a very nice or academically challenging environment, letter from an observership might even be more important than doing a hands-on clinical one. Now, that is not to say you shouldn't have hands-on experience. You should be able to examine a patient and develop note-taking skills, order in labs. The more you can do, the better, especially because if you say that in your residency interviews, that's going to make it better. But getting a strong letter from a good spot or a good teaching hospital or a good, I don't know, academically challenging environment is my main thing. Like, that is more important, I think, at least in retrospect. When I was choosing, I didn't know that as an IMG or sitting in Lahore just trying to figure out which ones to apply for. Yeah, so that was my second thing or third thing. I think that was my third thing, like how to prep for a systems-based approach and having a strategy, developing a strategy, and just some pointers that those two, inpatient and outpatient, how they kind of differ. Okay, so I also think it's really important is to remember to be punctual, be on time, dress professionally. You don't want to look, don't want to stand out, but at the same time, be professional, be somebody that looks like they're going to be a resident. You know what I mean? Embody that, dress like that, speak like that. Kind of important. You can always ask for research if your attending is doing any research by the end of the second week when you've kind of gotten comfortable. See if you can do anything remote once your rotation is ending. And in terms of that, I think a few cool things are maybe doing an NIH course online. NIH is the National Institute of Health, and that's in DC. And they offer a free research course with a certification about principles of research. And you can create a free account and start that. It has really cool lectures, and you'll be acquainted with the IRB protocols and things that are very US specific in terms of the research. So if you want to do and get published in the US healthcare clinical setting, acquainting yourself with that is very good. If you've done your steps, then you kind of will be familiar with what the course is offering, because USMLE boards will go into everything regarding when you're doing your biostats and your public health stuff from first aid or any of those things. The material that is on that course is very similar, but it's like it gives you a certificate and you can kind of say that you've done that. And the protocol settings and how to get approvals and stuff like that, or review boards and stuff, that is not in your first aid. So if you want to learn about that, they have that in the course. Yeah, so having that is kind of like, hey doctor, like I've done this course online, I'm kind of acquainted with this, I was wondering if you're doing any research, or can we write a case report together by the end of the 4 weeks, maybe remotely, and just asking casually, not to like sound unprofessional, but taking initiative is very important, right? So yeah, that is one really important thing that I think in hindsight I would tell myself. And last thing I want to say is how to request for a letter. I think the good time to ask is once 2 weeks have passed. Don't ask for a letter right when you go in or at the end of your first week, unless you're running out of time, which is like, why didn't you plan ahead? You know what I mean? And always request a copy of your letter if you can, because you might need it for job applications, you might need it for... One important thing to remember is that your attendings are busy and they probably have other things going on. So if not to ask them too many times, and then not to offer help writing the letter unless you think that they might be okay with that. So one way to kind of say that is to, if I'm happy to provide any more detail that you need me to, or if you need help writing it, please let me know. If you need help writing any more details about me, I'll be happy to provide that. So that just doesn't sound unprofessional, because get your letters, and then try to see if you can do any more research with them. Keep in touch. Try to have the kind of relationship with your attending where that they can open doors for you. So you don't have to be extra friendly or someone completely, totally memorable, but you definitely want to be somebody that was able to talk to them in a professional capacity and impress them with your presentation skills, impress them with your notes, impress them with your knowledge, obviously, if that's going on, and stand out in that regard. It's good to be somebody that is respectful, that comes across as someone that they would probably want in their program, right? Yeah, getting under a program director is amazing if you can get one with them, a letter from... So yeah, just kind of getting acquainted with the system as an IMG takes a while. So I just wanted to tell you the things that I thought I didn't know when I was applying and would probably help you. And be good content for this YouTube channel. Because honestly, a lot of times when I'm sitting there and I'm thinking, what do I make a video about? I don't know. I'm like, okay, I guess I want to do the fun things that YouTubers do, which is like, oh, get ready with me, blah, blah, blah. But this is the stuff that I feel like would make a difference in someone's life, because when I look back, I would want to watch a video like this and be like, okay, yeah, let me prep these 15 diseases before I come in and review all your screenings, all your vaccinations, all your guidelines, preventative guidelines. Everyone's gonna know. Every attending you're working under will want you to know, when do you do a pap smear, when do you stop? When do you do a colonoscopy, when do you stop? What is your like HbA1c guidelines in different people, and dialysis routines, and then how to mention that on your note. Like, you know what I mean? When you know that these are the things that ASCVD risk, stuff like that, they're gonna want to know everything about lipids, who gets a statin, who doesn't. Every single primary care or internal medicine rotation you're in, that's gonna be there. So if you review these things before you come in, you're just at an advantage. If you know how to write a good note, you're at an advantage. If you know what the US healthcare system is like, and you just, observe for the first week, take your time, dress nice, smell good, look professional, and just be yourself. You don't have to act like anything. And yeah, I think that goes a long way. So I hope this was helpful. Thank you for being here. Okay, bye-bye.